Hi everybody, it's 3 o'clock, so I'm going to go ahead and get started. Welcome to the Nursing Research webinar. My name is Cynthia Kramer, and I'm the Science Outreach Librarian here at Benedictine. And I've been working with nursing students for just about 4 years. It'll be 4 years in November. I get a lot of questions on, how to find nursing research, how to use specific nursing databases, and, help with creating PICO questions and researching PICO questions. So I'm hoping today's Express webinar will cover some of those topics and answer some of your questions. Okay. Sarah, did you hear me? Okay.
Yes.
Okay. Sorry, I just hit mute a couple times, so I just had to check. All right. All right, so my overview. So we're going to go through the definition of PICO, and this comes from the American Journal of Nursing's series, Evidence-Based Practice, Step by Step. I'll have some example PICO questions. We'll go over levels of evidence, some common challenges, search strategies, and then I'll dive into the databases and do some search examples. So let's go into PICO. So I find this so important that I made it an animated slide. Okay, so the very first part of PICO is the P, and typically that's going to be the population or the patient or the problem. Most often I think of it as a population, like first-time mothers or in older patients or in patients with heart failure. So that's what I kind of think of for the P part. So the next part is the intervention. So what is it that you're going to do or change that's going to affect the situation? Okay, so that it could fall under a couple different categories. It could be testing, it could be therapies, it could be education. Okay, those are some options. All right, and then you're going to compare. So you're going to have your population that you did the specific intervention on, and you're going to compare it to either another intervention or some sort of control group with no intervention. That's pretty common. So again, what are you comparing? And the next is O for outcome. So what do you expect to happen? What do you expect to happen, if you have diabetes, education, compared to people without education? Do you expect there to be higher, you know, medicine adherence, drug adherence, let's say? Okay. So look, what is your outcome? And then the T is in parentheses, and that's a time frame. So once you have all of this, you can add a time frame to your PICO question. But I think wisely that's in parentheses because you'll find that you've got a lot of specific topics to search here within, a lot of parts to this PICO question. So it's important to, start general, start with one or two things, and then you can add the time later. Okay, so in the article from the American Journal of Nursing, they do separate the different types of PICO questions. So the two that I find most common that students, the format that they use would be this one, intervention. So there's a fill-in. It's kind of like a Mad Libs. You can put in your information. So I went ahead and put in one. So in patients with heart failure, how does using the teach bag method compared to no patient education affect hospital readmissions? And then I put in parentheses within 30 days. So there's the parameters of that. Another one would be like prevention. Okay, so I've seen a lot of a lot of PICO questions that have to do with hand washing, using alcohol, different types of protocols. So, so in a specific population, like operating room nurses, what are the differences between microbes on natural nails and artificial nails at the time of surgery? So that's pretty specific. Um, Again, I'll go over some, what I consider to be best practices when choosing a topic and how to choose a topic using what, what research is available as well. And then there's also, you could do a PICO question on diagnosis. So that could be like in the PKU test that they do with newborns, or, you know, what are more accurate, which ECG is more accurate, something like that. So I just leave these in here because I'll be sending you the slides afterwards. You can check them out. And etiology, so like what causes a disease. Um, so like obesity is one of them. Again, I'll show you. Telemonitoring is a good one for you. So telemonitoring, again, anything that's education related is good for these PICO questions. So let's go over common assignments. So an assignment that you could get would be a research article critique or a research paper. So you could have 4 to 8 research articles about your topic, and there's going to be specific requirements. So, common is to have it within the last 5 years, and then have a nurse as the primary or secondary author. And then the type of article, you're going to want to have a research study, not a literature review. And we'll go over levels of evidence in a little bit, and you'll see why you would want a primary research study and not a literature review. And again, from peer-reviewed journals. So here's a level of evidence from Poe and White. So the very best is at the top, so the level 1. So the very best evidence is going to be from an experimental study that's randomized controlled trial, RCT. So the participants are chosen as random, and that's the highest level. And then the level 2 is quasi-experimental study. So it's still an experimental study, but the participants are not randomly chosen. So it might be just the 100 people that you have, the 100 beds that you have in your hospital. That's what you chose, but you didn't choose like a random sample of them. And then level 3, which is perfectly acceptable, is non-experimental or qualitative study. So a qualitative study is going to be a survey or opinions or interviews. So that's the level 3 of evidence. And then 4 and 5, you're probably not going to want to use for your assignments. I mean, they're going to be opinions of experts. And then that level 5 is where you've got case studies, literature reviews, quality improvement. I think when you look for articles, a lot of these are going to come. Literature reviews obviously come up, and quality improvement projects also come up as well. So just keep in mind, depending on the type of article you have, it's going to have a different level of research, different level of evidence. Okay, some common challenges that I see when working with students is that they're not choosing an original research article, but pulling out a review or looking at a continuing education article, selecting articles that are not nursing focused, so that a doctor or public health person is the primary author or authors. And then another pitfall students have is that they try to find articles on their exact topic. Because remember, I went through the PICO and I said there's all these different components. And if you try to look for all of them at once, you're probably not going to find anything. You might find 1 or 2 things, but there's a better way to approach it. So when looking for your topic, it's important to start broad. because you want to, when you're looking through the databases and seeing what's out there, it's better to start broad and see what your options are within. And you got to ask yourself the question again: is this a nursing research or is it medical research? Or you could ask yourself, is it something I could implement where I'm working right now? And I just put in some common nursing interventions, would be education, telehealth, alternative therapy, sometimes shift work, alarm fatigue, simulations. I just threw out some of the topics that I've come across. So the key strategies, the database I like to start with is CINAHL. So that's an EBSCO product, so I'll show you how to get to there. Do the last 5 years, and you'll want to click on Research, English for Language, and they have an option for any author is nurse, and that's very helpful, except it only, right now, only goes to articles up to 2015. So if you select that, you're going to be missing literature from basically 2016 to 2018. So I wanted to put that in as a caveat. I don't necessarily recommend it right away because of the lack of articles. And if you're doing this strategy in CINAHL and you come up with one really good article, you could also go and search that specific journal for similar articles. That's another strategy to use, especially when your topics get really specific. So here is a sample topic, and I'm going to go through searching it. All right, so the topic is, heart failure patients using the teach-back method for instructing patients and reducing 30-day readmissions. So the keywords out of here that I'm going to choose are heart failure and teach-back. Okay. So ben.edu, library. So now that I'm on the library homepage, I can click on databases and choose health and medicine, and then click on CINAHL plus with full text. So I'm going to put in heart failure, and teach back. Okay. And I am going to include the hyphen. I've practiced this a couple times. So, all right. And then I'll put in the year, 2013 to 2018. I'll choose English language research article. And I'm not going to choose that any author is nurse right now because of the limit, because it only does articles to 2015. So I'll click on search. Okay. And then I get 18 articles. Now on the side here, this is where I have my limiter. So you can see my search, heart failure and teach back, last 5 years, English, research article. And then it tells me what they are. So 5 of them are dissertations. So a dissertation is not going to be a peer-reviewed journal. So I'm going to go ahead and click on academic journals. Okay. All right. So here's the first one. All right. So this is an assessment of the nurse's knowledge. So that's not going to help my topic. This one, I'm going to tell you, if it has something like this, it's typically a small presentation or a power, like something you would present at a conference. So I'll bring that up just to show you that it's very short. It's not a full paper. So all right, so we'll look at this one, reducing readmissions using TeachBack. So to get to this article, so you see that one I clicked on PDF full text. Here I can click on find full text and go through. Okay, and this article is in Ovid, which is another nursing database that we have. So I'll click through. Okay, and then I find it most helpful to look at the PDF, so I'll click on Articles PDF. All right, so good. I can see that my authors are nurses here. Let's see. I'm even gonna open it up so it's even bigger here. Okay. All right. And then I see it's a quality improvement initiative, so it's not going to work for what I want to do. Okay. All right, so now I'm going to look at number 4 here. So I'll click on linked full text. And this one, I'm going to go ahead and open up the PDF. As I said, that's how I prefer to look. Let's see. And it's just an abstract. Okay, so that's not, it's not going to help me either. All right, so you can see that this is kind of a difficult topic. And so what I would probably do with only these 7 results is I would expand it out. So instead of just having heart failure, I do heart failure and education. Okay, and you can see the systematic reviews are coming up. All right, so like here's the effect of cardiac education, patients with heart failure. So this one looks good. Okay, let's see. So yeah, what I'm looking for is I want to see, okay, well this is a level 2, it's quasi-experimental. Okay, so I like this article. This article would be fine. Let's see. Okay, so if I liked this, I could click Email Jumpstart and email a link to myself, and then I'd be able to go back, or I could download and save the article. All right, so you can see that you know there's definitely some strategy involved, and there's so many parameters that you have to think about whether an article would qualify. So the first article you grab may not meet all the requirements that you need, and so you may have to expand your get a little more general. So let's do another search. Okay, so another topic would be using acupressure for decreasing postoperative nausea. So the keywords that I'm going to use are acupressure and PONV. So you can see in this case, I just dropped the time frame because I want to see what kind of articles are available. Okay, so if I go back in here, all right, I can put in acupressure. And then PONV. Okay. All right. Okay, and again, it saved all my limiters. So last 5 years, English, research. All right, so let's look at this one. Acupressure and management of postoperative nausea and vomiting in high-risk ambulatory surgical patients. All right, so this is linked to another database. We have Science Direct. Let's see. I'll go ahead and open the PDF. Okay, and when I'm looking, what I'm looking for is designed, randomized, blinded, placebo-controlled, experimental design. Okay, So that looks pretty good. So this article would work. Let's go back. Okay. We'll just look at one more. Oh, and then sometimes the same article will show up twice. Okay, so this is the same one we just looked at. So, and here's a comparison of two types of these acupressure wristbands. So let's check this one out. Okay, and let's see. Yeah, so this is probably quasi-experimental, but you know, the authors are nurses, so it does look good to me. And this is in the journal. If you looked back, it would say the Journal of Peri-Anesthesia Nursing. So let's say I wanted to search just this journal. All right. So when I go in to the library homepage, and then instead of clicking on articles, I'd click on journals by title. Let's just see what happens if I do this. Let me bring it up again. Well, we'll just do Journal of Nursing Administration. Okay, Journal of Nursing. Okay, so I could bring up the specific journal, and then I can click through to where it's at. So here, this is in our PICOT collection. So I can click here. These would be in print, and so here it says it's in print until 2005. So I can click here, and then I can click, you know, what are my, let's say we're looking at diabetes. Okay, and then, you know, since this is a nursing journal, let's see, search. Okay, and again, many of the quality improvement studies are going to say so in the title, so you know you can move past that. Okay, and here, this is interesting. This is an internet-based survey, so this would be one of those qualitative studies. Okay. So again, I showed you that you can search for a journal by the Journals tab. I've got another topic I can search for you. So this is going to show you how I would go about developing a topic. So in those last two cases, I had a pretty fleshed out topic already, but here is if I wanted to pick a topic. So let's say I wanted to look at, okay, so Peggy says, what are tips to assist students in identifying type or level of article? Okay, so what I do, and I'll do that when I'm in this CINAHL prevention. So if I go in, I'm in CINAHL, my favorite database, okay. Prevention. Okay, so one thing that helps is to have that research article selected. And then, you know, so like, let's see, oh, the dissertations came up again. So academic journals. appraising literature. Qualitative analysis. So let's look at this qualitative one. Okay, now for me, it says qualitative, so that's already going to go in my mind, okay, qualitative, that's level 3. So you can go in, but typically what I tell them to do is to open up the PDF and go straight to the method section, because that's where you're going to, so here it says, a cross-sectional qualitative study. So that's where that, when I tell the students to go in, go straight to the method section, it should tell right away what level of evidence it is. Does that help? Yes. You can always call the library, visit me on the 3rd floor, or shoot me an email, and I'd be happy to work with you.
This concludes the webinar. Thank you for joining us, and please join us next month for our webinar on using Google for research.